Hey, how's it going? I'm Dr. Alvarez with Endobariatric.com and welcome to another episode of our FAQ section. And today we are going to talk about bubble gum. And this is very, very, very common, and I wanted to bring it up because we haven't touched the subject since back 2015 that we mentioned it in the video. And this is very common because there's a lot of patients that like chewing gum, and there's a lot of patients that want to chew gum right after surgery because they have that dry mouth sensation. All right, so here goes with the bubble gum. Chewing gum is not a good idea with a gastric sleeve patient, specifically the first few weeks, maybe a couple months right after surgery. And there is a reason for this, and I need you to understand this. If the patient doesn't understand, they'll go grab some gum. So here goes. When you chew gum and you're chewing gum for a certain period of minutes that you have the gum in your mouth, you are unconsciously swallowing some air. That air will go down through the esophagus into your new stomach, your new sleeve, and it may feel uncomfortable. That uncomfortable sensation is something I want you to avoid, and just stay away from that. Now, will you burst anything inside? Will you hurt yourself? Would you hurt that sleeve? The answer is no. You might feel that uncomfortable sensation. That's something I want you to not feel and stay away from. But truth is, your sleeve will be intact. It's just that air that builds up. You know that sensation, or when you see those newborns, those babies that they're breastfeeding, and right after that they are uncomfortable until you burp them? That is exactly the same sensation because your sleeve is brand new, it's swollen, and if you pump some air in there, because chewing gum will pump some air into that sleeve, you will feel uncomfortable. That's why babies cry until you get that, you burp them and get that gas out. They feel relieved. So that same sensation will happen to you right after the surgery. Now, do I need to stay away from gum forever? The answer is no. I mean, maybe 2-3 months after surgery, you're able to tolerate the gum pretty well, fine. Do it. It's not a problem at all at that point. It's just the first few weeks right after surgery, you might get that sensation because the sleeve is very, very, very swollen because it's just barely crafted, and chewing gum will give you the sensation. But Dr. A, I really like hard candy. Can I do hard candy? Hard candy is not a problem. It's just chewing gum that is a problem. All right. So I hope you find this useful. If it was, hey, leave me one of these because it's very, very helpful to me. I appreciate your support. And if you're into gastric sleeve and more tips, I would consider subscribing to our channel. That way you don't miss any of our future episodes. All right, so there you have it. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives. Yes, we're changing lives one sleeve at a time. Take care. God bless.